One. Dr. Carlton, welcome to the Alphabet Mafia podcast. Thank you for joining me.
I'm so excited to be here, Ryan.
Absolutely. I'm so excited to talk to you. I've been following your TikTok for quite some time now, and all your content is it's just amazing. It's incredible. It's educational, it's funny, and it's very important to, I think, our community, to the queer community. So I guess just starting off the bat, like who is Dr. Carlton? Introduce yourself.
Well, I'm a gay gastroenterologist. I was raised in a really uber conservative, very poor tobacco town in South Carolina. I always knew I was different as a kid. I wanted out of there because I just didn't fit in. So I kind of scratched and clawed my way to achieve what I wanted. I grew up watching things like the Beverly Hillbillies and the Brady Bunch. Your listeners probably don't know what those shows are, but
I barely know what those shows are.
Yeah, I know, right? It basically glamorized life in Southern California, and I thought, well, that's where I want to be when I grow up. And I always wanted to be a doctor. I think I got stuck saying it when I was like a 7-year-old in front of my parents, and so my parents kind of held me to it. Oh, he's going to be a doctor. So I just kind of went with it. To have started on basically a farm in South Carolina and end up at Mayo Clinic in Minnesota, which is the world's best facility for what I do in gastroenterology, which is digestive diseases, basically. It's pretty remarkable. I originally, got out of there, got my first practice in Palm Springs with a very Beverly Hills clientele. I had 2 kids by surrogacy with my husband, and we moved to San Diego eventually because Palm Springs is just too hot for a 4-year-old to play baseball outside. My son was like, Dad, can we go out and throw a baseball? And I said, we might spontaneously combust. So it made me realize that it just wasn't a good place for kids. So I moved to San Diego, where now I am proud to serve the local LGBTQ community as a resource for healthcare without judgment or shame. I kind of stumbled onto TikTok during the pandemic and realized the need and the hunger for anal sex education and just sex education in general. It's pretty shocking. And not just from LGBTQ family, but also women and straight men interested in butt play and things like that. So many people are embarrassed to talk about anal sex or to ask questions. But let's face it, most people want to know how to do it right, how to do it well, how to do it safely. And I thought, well, who better to ask than a gay GI doctor who not only knows the medical side of things, but also, is no stranger to anal sex himself as a gay man. So, the education doesn't stop there. There's so much attached to LGBTQ healthcare that needs to be addressed, and including how to find a relatable doctor, STI treatment and prevention, body image issues, relationships. You kind of open Pandora's box.
Yeah. Yeah, and you're doing amazing work. I mean, you're as I said earlier, your videos, they're educational. Like, I learn stuff even now, like, on your videos, and there's a lot of people out there that need it because you're right, we don't get it in school. We don't get it from our parents or our friends. So
exactly.
Very important. So growing up in the Deep South, in kind of like a hillbilly town, as you said,
right,
and being a young queer person, how did that path to becoming a doctor unfold? Because a lot of young queer people, they feel like they can't achieve their dreams or reach that pinnacle of success because they are queer, that they see it as a setback. So what did that look like for you, that journey of being from a small town but also being gay and achieving your goal of becoming a doctor?
Well, for me, being gay in the South, and at that time especially, in the 70s and 80s, it was terrifying because there's basically a church on every square block of my tiny little hometown. And let's face it, they're not exactly manned by rocket scientists. So, there was a lot of shame about sex, about homosexuality. I knew I had to get out of there. And so my ticket out was an education. Mm-hmm. So that's what I focused on. also you have to keep in mind with me that I grew up when AIDS really, I was 12 years old in 1984 when AIDS was really like on the front page. People were dying left and right in the gay community. They called it gay cancer. And I really, I was terrified to have sex. I was terrified to be gay. I thought I was a death sentence, and I dealt with that until I was in my, probably my 30s. I thought, oh, well, I'm doomed to die when I'm in my 40s, oh, well.
Wow.
So it was just a different time. And I don't think that young queer people these days have a grasp on what that was like and why older gay men like myself or the queer community itself, has some issues and baggage with all that. It was a lot to deal with. We saw people die. My friends who were in New York City at the time in the 80s were saying they were going to, 10 funerals a week. It was scary, just crazy. So I got zero sex education, barely straight missionary penis vaginal sex, let alone anything remotely geared to what I needed. I was sort of naturally drawn to GI medicine, even in med school and residency and fellowship. There really wasn't even a single class throughout high school, college, med school, residency, fellowship about gay sex. And I basically am a butt doctor. So it was pretty shocking that even in medical education, we got very little education specifically on gay health.
Sure.
So
sure.
yeah. So that's that's where I really got my fire, and I wanted to change things, and here we are today.
Yeah, absolutely. And being young at the time of AIDS and seeing all that around you, I'm sure that was part of your inspiration for wanting to be a doctor, because you want to help people be healthy, especially the queer community be healthy.
Yeah, absolutely. And then my dad was, he was chronically ill when I was a kid too. And I also just wanted to do something to help not only him, but people like me who had to suffer and watch their dad in chronic illness for basically 15 years of their lives. Mm. So, yeah. So those were big inspirations for me.
Is it different now? As you said, in med school, there was no curriculum around gay sex or even mention of it. Now, if you were to go to school, is there some sort of, do they talk about it?
I think it's becoming more open and more discussed. But even on TikTok recently, there was a girl who, I think she was a woman who was a 4th year med student who did a TikTok about, she was in the emergency room on her emergency room rotation. And a guy came in who had was having rectal pain. And she asked him, well, when do you have rectal pain? And he said, every time I use a dildo bigger than 1.5 inches wide. And so she absolutely freaked out and lost it and didn't know how to handle it. And she ran to her attending physician, one of the older ER doctors. And all he said to her was, well, tell him to use the dildo smaller than 1.5 inches in width.
Wow.
And so she came back and she said, so guys, please don't use dildos long, wider than 1.5 inches. And I'm like, whoa. That's, that was that guy specifically. That's not everybody. And then I basically went on to, and she was part of the LGBTQ community. And I did a TikTok on this and I said, listen, this isn't your fault. You didn't get the education. None of us got the education that we needed to be good doctors for the gay community. So it's not your fault. For starting in the elementary and middle school and high school ages, we just didn't get this stuff, and it just kind of carried on through all the way through med school for her too. So I think there still is a lack in gay sex education in the professional schools.
Oh yeah, absolutely. I mean, I could imagine, and I know from my experience now, I never went to med school, but even in high school, I went to a Christian high school, and our extent of sex education was, don't have sex.
Exactly.
But if you do, if it slips in somehow, but you're not supposed to, then wear a condom. That was it. But we didn't even practice it. We didn't put condoms on bananas. It was terrible.
and make sure you have the baby.
Yeah, right. Exactly. No such thing as Plan B. Abortion, that's a sentence to hell.
Right, exactly.
And so another a big thing in our community, and as you mentioned, was well, there was the AIDS crisis, obviously, but the overall greater reach at that is STDs and STIs, and that can affect, that can affect anyone. But of course, we want to focus our conversation on the queer community, non-sex queer education. So, what are STDs in a general layman's terms?
Well, STDs or STIs are sexually transmitted infections, and there are some very common ones out there. We talked about HIV and AIDS. So HIV is a virus that causes AIDS. Now, when I was growing up, it was almost a sure death sentence for a lot of people. I mean, some people escaped it and it was remarkable and were able to get to the point where there was medication for it to keep it under control. But you have to understand that these days it's basically a chronic illness like hypertension or diabetes. You take one or two pills a day these days, and you can treat HIV. You have to have your labs monitored carefully, and you have to see your doctor regularly. But it's definitely something that's manageable. And the most important thing now about HIV is completely preventable. Not only with condoms, but there's PrEP. PrEP is pre-exposure prophylaxis, which is a medication that you take. It used to be only daily. You have to take it daily to prevent HIV. And there's a greater than 99% effective rate of preventing HIV with PrEP. But there are new regimens, especially in this era of COVID, where people aren't exactly having sex every day, or they're just not built. That's just not who they are. They don't have sex every day, and they're able to plan sex, where you can alter your regimens to a 2-1-1 pattern, where you only use it when you're being active. So HIV obviously is the big one that everybody worries about, and it led to the AIDS crisis, but now is a very treatable thing. And another important thing in our community too is the discrimination within our own community against HIV positive people. And that's one of the things I really want to see ended, because when people are undetectable on medications, they cannot transmit the virus. But I have friends who get these horrible messages on apps like Growler and Scruff and Grindr. As soon as someone finds out they're positive, they just absolutely just lose their mind and block them or treat them nastily like they're some leper. And that's something I really want to end, because you can't get HIV from an undetectable HIV positive person.
Right. I think the important thing is positive but undetectable. That's
right. Positive but undetectable. Yeah, they have to be undetectable and on medications. But yes, definitely. That's the most important part of that. So that's spread by blood and body fluids. Condoms and PrEP pretty much eliminate that as a risk. Another one that's preventable, especially these days, is human papillomavirus, or HPV. HPV causes genital warts, anal warts, cervical cancer, and is a risk factor for anal cancer as well. The Gardasil vaccine that you get in 2 doses used to be only for girls at very young ages, but now it's approved for males and females, and you can get it up to age 45 now. And hell, I know doctors who give it to men older than 45, just because why not prevent human papillomavirus if you get the chance, right?
Yeah. Is that the one that you get in like 3 stages? There's like 3 rounds of shots, or?
I think it's 2. It's 2 for kids, and for adults, I'd have to check if it's 2 or 3 now. But yeah, so it is more than 1 shot, so you have to come back consecutively for it. But it definitely another preventable, potentially devastating issue. I can't tell you how many men I see when they come in for their colonoscopies who have anal warts because they didn't have the chance to get the vaccine when they were younger. And when you're HIV positive and you have HPV, the combination of those 2 things huge risk factor for anal cancer. There's a 70 times increased risk for anal cancer when you're positive and you have HPV. So it's important to know that you have it. If you have anal pap smears, just like women get cervical pap smears to look for dysplasia of the cervix when they become sexually active. Men need them in their rectum to check for any sort of anal dysplasia or evidence for human papillomavirus. And, really the vaccines are amazing. They speaking as a gay man who's 49, I wish I had it when I was 12,
Sure.
Yeah. So
what's a pap smear? I wanted to ask that.
So a pap smear is basically where your doctor takes a little Q-tip and inserts it into your rectum or into your cervix and swirls it around and then puts it in a little container to get the cells in it analyzed.
Okay.
So, definitely something that a lot of doctors aren't really up on. And sometimes a lot of insurance companies don't necessarily do a great job paying for, but I think it's a really important thing. I've caught several cases of human papillomavirus in patients that was like one step just before cancer that wouldn't have been found if it hadn't been for that test. So another important test.
How often should people be getting tested?
Well, that's
for STDs or papilloma tests.
Well, yearly on the papilloma test, I think at least for a few years. On STIs, it really depends on how active you are. If you're in a monogamous relationship, you obviously, and you get checked once, you don't really need to get checked again unless there's some sort of change in that relationship. I had a guy who approached, and the education part on that is kind of shocking. I had a guy who approached me on my Instagram and said, yes, I have a new boyfriend and I think I need to start PrEP. We're monogamous. He's negative. I'm negative. Neither one of us has STIs, but I think it's important for me to start PrEP. And I said, actually, you don't need to. You don't need PrEP if you're monogamous and you're both negative. So unless that changes in your relationship, no need for that. One of the next ones I wanted to talk about as far as, let me go back a little bit.
Sure.
So we asked how frequently you should be tested. If you're on PrEP, it's recommended to get checked every 3 months. So, and part of getting your PrEP medication renewed is that every 3 month STI testing. Now, if you're less active, then you can stretch it out to 6 months, at most a year. But obviously, if you have any sort of interaction with another person and you're not sure about STI status, and especially if you don't use protection, because a lot more people are barebacking these days, make sure that you get checked.
Yes.
Gonorrhea and chlamydia are huge problems right now. Even in my practice, and like I said, I usually just do colonoscopies and things like that. STIs are generally not my area, but I see a lot of gay men who have gonorrhea and chlamydia in their rectum. And I asked them, well, didn't your doctor ever check your butt for STIs? And they said, wait a minute, you got to get your butt checked. So people really don't know that as far as gonorrhea and chlamydia goes, wherever you put a penis, you have to get that area checked. So if you do oral sex, you got to get your throat swabbed. If you do anal sex, you got to get your butt swabbed to check for gonorrhea and chlamydia.
Okay, wait. I think I'm going to be needing to make some appointments here soon, because I thought what I do or what I've done is the full panel blood test. Is that not correct? They need to...
Yeah. But see, blood tests only check for syphilis, hepatitis, and HIV. So for gonorrhea and chlamydia, you actually have to get either a urine test if it's more of a penis or vaginal sort of thing where you're active, and if you bottom or if you suck dick, you need to get your throat swabbed and your ass swabbed.
Okay. Wow.
Yeah. So we're learning. All right. Good.
We are.
Okay. I'm glad that we're on this. Yeah. And it's shocking as a doctor that even doctors don't know that. Like I have a patient, or actually I have a TikTok follower who said that she's straight, but she sucks a lot of dick. And and she saw that I said that she needed to get her throat swab. So she went and asked her doctor, hey, can I get one of those gonorrhea throat swabs? And he said, there's no such thing. I'm like, are you kidding me? Yeah. And like I said, it's important for you to get checked where you have sex and everywhere you have sex, because I have patients who I do their urine test to check their penis. I do their throat swabs to check their throat, and I do their rectal swabs to check their butt. And only one of the three will end up being positive. So it depends on where things happen. So you really do have to get checked where you play. Yeah. So as far as gonorrhea and chlamydia, the guidelines have changed on treatment now. Gonorrhea used to be a shot of 250 milligrams of ceftriaxone. It's gone up to 500 milligrams. There is more resistance to gonorrhea these days, and there's a super bug of gonorrhea that's gone around in some of the larger cities, which is a little concerning. And I've had, followers on TikTok tell me, yeah, I was in the hospital in New York City for like a week getting IV antibiotics because nothing else would treat it. So that's a little bit, that's a little bit scary.
Sure.
Chlamydia, it used to be that you get a gram of azithromycin for one dose, and that was it. We recommend now to do doxycycline twice a day for a week, but it's very effective at clearing chlamydia. Syphilis is a more serious STI. It's basically shows up like and let me go back a little bit. As far as gonorrhea and chlamydia, they can be completely asymptomatic. They can cause burning or discharge on urination. They can cause rectal pain. They can cause throat pain. Those are the ways those present. HPV is basically, it looks like warts, anal warts or genital warts. And those can be frozen off. And if they're internal, they can be surgically taken care of. So HIV obviously doesn't look like anything. So there's just no way to know. You have to have the blood test. And then with syphilis, you can get a sore as well. But once the sore goes away and you haven't been treated, syphilis can cause rashes on the palms of your hands and the soles of your feet. And then the end stage of syphilis, it can go to your brain and cause some neuropsychiatric problems. So that's a real important one to get checked for. And that's probably, when you mentioned your blood panel, that's one of the things they're checking for, because it's just a blood test. Obviously herpes is more like a blister type sore. Shockingly, a very large amount of the gay community has positive herpes antibodies and just doesn't even know it. I've read studies up to like 90% have positive. Wow. Yeah.
So we all kind of just have herpes already.
Yeah, mostly. Yeah. It's kind of, but not everybody is symptomatic.
Sure. Okay.
And if you're symptomatic, it's not a very fun thing to go through. I really feel for my patients who have to go through that. Hepatitis A and B are now sexually transmitted, possibly, but they are covered by vaccines usually now as a baby and up through high school and college and everything. So hepatitis A and B are pretty much covered, but
are some of these like chlamydia and gonorrhea, are they asymptomatic, or you can have them without really knowing you have them?
Yeah. So gonorrhea and chlamydia can be pretty asymptomatic, especially if it's in your rectum. It can range from completely asymptomatic and, I'm shocked that I had something, to I've seen them where they look like they have a bomb that went off in their butt. I mean, just for gonorrhea and chlamydia, it's shocking. And I don't want to get sex negative on this stuff. I'm just telling you that these are the STIs. The last thing I wanted to talk about in the gay community particularly is from rimming. There is a potential infection called Giardia. Giardia is a bug that causes extreme diarrhea, bloating, and gas. It is commonly spread through anal oral sex, so rimming. The person that you rim has to have it for you to get it. So I always recommend people to just make sure that if you're going to rim somebody, Make sure you shower first. Make sure you do use a little Listerine after. And actually, there's studies that show that Listerine after oral sex decreases the amount of gonorrhea and chlamydia bacteria in your mouth too. So if you get a chance, you can remember it, and it's something easy to do. Why not do a little rinse with Listerine?
Yeah, I mean, I would assume you would probably want to
do that anyway.
Unless you want to go to sleep with his asshole on your mouth. I mean, well, I'm not judging. I'm not kink shaming.
Well, listen, some people do like that. So.
That's true. So wow, all these STDs. I can't believe that I didn't even know like that it wasn't just, it was more than the full panel blood test, because I'm like, I'll be honest, last time I had sex, we're in a pandemic, whatever, it was August. Right. It's been a while for me, but I got my full panel blood test, and I'm like, I'm good, like I'm clean right now. And now you're telling me that like that might not even be the case, because there also could be asymptomatic.
Right.
Yeah.
Right. So it's one of those things where you have to get checked for those particular infections where you play. And that's one of the important messages I wanted to bring across today. So I think one of the other things we're going to talk about was, how do you find a doctor that gets you as a gay person or LGBTQ plus person?
That's right.
How do you find a physician that you can be honest with and tell them that you stick it in your butt or in your throat or whatever, or that you had sex with 10 guys last week, without being shamed, right?
Sure.
So, yeah. So, have you ever had access issues with your healthcare, with finding a provider that you're comfortable with?
No, it's been fairly easy for me. I've had 2 doctors since I've been an adult. One was in college, and it was a fraternity brother's mom. And this fraternity brother was very like hippy dippy, like Grateful Dead fan. And his mom was pretty similar. So I felt comfortable going there.
Yeah.
And she was cool with it. Because I was a little bit of a whore in college, so she was like, I was getting tested quite frequently.
Nothing wrong with
that. She
that.
didn't give a shit. And then in LA, I just looked up like doctors in LA, and I found someone that like looked young and just looked, whatever. Like they didn't look like they would judge like an old grumpy old man. So I went to him in LA, and he was fine too. So I haven't had much discrimination or anything like that. But I'm kind of upset that they didn't tell me more about these testing. That's where it kind of lacked off. Yeah. Yeah.
And I think that maybe that's why STDs are such a problem in our community, is because they aren't getting checked right. So that's one issue. And that's not the patient's fault. That's a lot of times the doctor's fault. So doctors need to be educated too. It's not a one-way street. I've had a couple of issues in my own search for healthcare that have led me to make sure that I'm very sex positive and positive influence in the gay community and the queer and the lesbian, bisexual, trans community. It's really important. I was in med school, and I had a new boyfriend, and my former boyfriend and I had sex a lot, and this new boyfriend and I had never had sex before. And I thought, and this was in the 90s when AIDS and HIV was a big deal, a real big deal. I mean, it was, life or death kind of thing.
Yeah.
So I went to the student health office at my medical school and said, I'd like to get an HIV test because I have a new boyfriend and we're going to have sex, and I want to make sure that I'm safe for him. And they slut shamed me, and they made me feel like trash, and they belittled me. And I've never felt so low in my life. So I wanted to make sure that when I was a physician, that I got to the point where I would be the exact opposite of that scenario. But you mentioned finding doctors that seem to fit your needs and your profile, like you did your research. One of my TikTok followers and Instagram followers is a doctor in training in Arizona, and he moved from one school to another for his last half of his training, and he got to Tucson, went to a doctor there who was about 85 years old, he said. He walked in the door and he said he wanted to go on, his medication was Truvada. And he says, oh, so you have HIV then? He goes like, no, I don't have HIV. I take it for PrEP. And he goes, what's that? And he explained what that was and what he needed every 3 months. And the doctor said, I don't think I can take care of you.
What?
Yeah. So
Wow.
not everybody has a good experience. So
Sure.
one of the things that I want to make sure that people have access to, there is a, you don't have to have a gay doctor. If you have a great doctor and you're comfortable with them, great. You don't have to have a gay doctor. But if you want a gay doctor or lesbian doctor or bi or trans, there's a Gay and Lesbian Medical Association, which is glma.org. So that's a big group of medical professionals all across the country who are either gay, lesbian, bi, trans, queer, or they're supportive of the community. And they list themselves in this directory that you can go online and put your zip code in, and you can find doctors in your zip code that are friendly or gay themselves. So I like to make sure that my followers always have that website, glma.org. Now, if you're,
I'm going to link that. Link that in, for the listeners. I'll be linked in the show notes if you want to go to it right now.
Awesome. Perfect. The other thing that I wanted to let you guys know is that, if you're in rural Alabama, the likelihood of you finding a gay doctor in your neighborhood is pretty low. So you have to deal with the best you can, and you have to be a proponent for your own medical care and say, this is who I am. This is what I need. Help me. Most doctors will, even if they're in a conservative area. Interview your doctors, interview the offices, make sure they're comfortable with gay patients. Because although it's discrimination to a degree, for not taking care of you, you don't want somebody taking care of you who doesn't understand you.
That's true. Yeah.
Yeah. I mean because then things get missed. You need to be 100% comfortable with telling your doctor, I slipped up last week. I got in the ass and I didn't use a condom. So could you please help me? I need to get checked. This is what I need. So, or I need PEP, which is post-exposure prophylaxis, which is used in someone who's negative, who's not on PrEP, who has either unprotected intercourse with someone who may be positive and detectable, or they don't know the status, or use injectables that are shared with other people. So that, just because you do those things, if within a 72-hour window, there's a way where you can get help if you mess up.
So you accidentally maybe come in contact with someone who might be positive, HIV positive. You can get on this. What was it? PEP?
PEP, which is post-exposure prophylaxis. So if they're undetectable, then it's not an issue.
Sure.
But if they're positive and detectable, or you don't know their status, and listen, that happens a lot. I mean, people just get horny and they mess up. They don't ask. They don't talk. Yeah.
Do you find that, I'm just curious on this subject, do you find that like people, and I don't know how much you might know about it because it's a little bit personal, but like, do people lie? Do you find that patients come in and they're like, oh, this guy told me he was negative and this happened? Like, I don't want to scare people, but I'm also just like concerned or curious about it.
Well, listen, yeah. If someone's HIV positive and they're on medications and they say they're undetectable, the likelihood is that they are truly undetectable in my experience, because if you're brave enough to tell somebody you're positive and that you're on medications and that you are undetectable, you probably know your shit and you're on your healthcare.
Yeah.
But there's a lot of guys who say they're on PrEP and they're not, and they're barebacking and they don't care and they don't know. So what I like to tell people, and this goes back to this whole U equals U thing, which I think is important, is that it's safer to have sex with someone who is HIV positive and undetectable than someone you have no clue what their status is, and they don't have a clue.
Right.
So, you are responsible for your own protection, and that whether that be PrEP, condoms, or if you bareback, that's your choice. And I don't come down on people and judge negatively for that. I just want people who do that to be aware of the potential consequences so that they know what to get checked and treated so that they don't have any bad outcome from it.
Absolutely. Yeah. And I think it also just boils down to like you said, self-responsibility, and do the most or best that you can to protect yourself.
Right.
So Stay on PrEP, even if you think you're having sex with someone that's HIV negative or whatever. Like, just protect yourself.
Yeah, absolutely. If you're sexually active these days in a non-monogamous fashion, there's no excuse not to be on PrEP. Now, there are people who aren't candidates for PrEP, people who have kidney issues or people who have bone density issues. Those are the two things that we have to monitor for carefully when you're on PrEP. But you get tested every 3 months for these issues as far as the kidneys go. So, and then the bone density thing, that's usually checked every couple of years if you need it, or if you're at risk for bone fractures and things like that. So, yeah, so those are the big issues that people need to be aware of.
And I wanted to ask you, what was the whole, I mean, and thank God it's now been repealed or it's been fixed by Joe Biden, but there was the Trump administration passed, this thing, or the headline was that he's restricting access to transgender people having healthcare. Did you see that in practice? What was your perspective from the doctor's office?
Listen, it didn't affect my practice at all. I mean, I would never let a transgender person or a gay person be refused access to healthcare.
I didn't mean your personal.
But personally, no. But yeah, so it was written into where basically, if you wanted to discriminate against someone because of your religious beliefs, you could do it. And trans people weren't allowed in the military, or they're about to be kicked out of the military. That's all been changed now, just with the stroke of one pen and the right president in office. Yeah. So
it was if you're a religious doctor, you don't agree with trans people or whatnot,
then you can say no.
Hey, no.
Wow. Yeah. There were all kinds of issues that went along with that. So it's like, what year is it? It's 2021. What?
Jesus. Well, yeah. I'm thank God it turned out the way it turned out. Thank God we're at this place we're in here now.
Yeah, we have so much brightness ahead of us if we can just get through this pandemic, I'm sure.
Yeah. So let's move to a fun topic.
Let's talk about good stuff. Let's talk about feeling good.
Get down and dirty.
Yes,
talk about bottoming. Just explain to me the anatomy of the bottom. We'll start there. We'll start with just like the anatomy, the scientists of the bottom. What's down there?
Okay, so this is going to be really cool for a lot of people because you're going to learn the science of why things feel the way they feel and how to make them feel better. Because there's some great doctor tricks that you can incorporate into sex and preparation for sex. It's going to make it a lot better. So basically, there are tons of nerve endings down there. I mean, it is just rich in nerve endings. So something as light as a little touch, a blow with the puff of air, a feather, a tongue, all that stuff, it just drives people wild because it's so rich in nerve fibers just externally around the area. So if you're looking at in the female anatomy, you have the urethra and vagina up front. Then you have the rectovaginal sheath. You have the rectum. Above the vagina area is the uterus, and up into the rectum, and then in the front above the urethra is the bladder. So you kind of have bladder, uterus, and rectum up higher up. Okay, and in men it's penis, urethra up front, and scrotum, and then behind that and up higher you're going to have the bladder where you store your urine to allow it to prepare for exit. Okay, and then you have the perineum, which is what we call the taint or the gooch in popular culture. So you have the scrotum, and between the scrotum and the asshole, the anus, is the taint, because it taint the asshole and it taint the scrotum. So so that's where it comes from. So basically, the anus itself, when you go in there, that's the rectum, and up about 2 inches in is on the front wall of the rectum is the prostate. So you've got bladder sitting on top of the prostate, and then the rectum behind it. And then so when a doctor does a finger exam up there, The prostate is located if you're bent over a table at 6 o'clock. So the doctor goes in like this, about 2 inches, and that's where your prostate is. Okay. So if you are on your back and your partner is in front of you and wants to play, then they just kind of do a come hither motion because it's at 12 o'clock.
Right.
So,
it's like up. It's almost like the way I, because I'll give you a little backstory. Like when I came out and I was like hooking up with guys, like I knew nothing, right? So I was like,
sure.
Well, how do I be good at this, right? Like I want to make sure that they come back, or that if,
right.
you know, like, so I did my research, and I've now had plenty of experience, but what I kind of like live by or learn is that it's that you if you're on the back, you put it in, and then it's like you're almost pointing it towards where the penis would be. That makes sense?
You point
like
up.
Where, you point up. You're aiming it at the,
but if they're on their belly, then
of course it's the other way.
It's the other way around. Yeah.
You're like, it's almost like a magnet to the penis. Like
right. Exactly.
Whatever direction it is, you want to hit that. Yeah.
Right. And so, you know, obviously have the great feelings of the frontal anatomy, but back in the anus, so you have an external and internal sphincter, which are basically tight little muscles. So sorry there. So if you think of the anus itself as a circle or a clock, like in a clock formation, the external sphincter is made of skeletal muscle, and it's something you can control. You can relax it and you can squeeze it. So to make it tighter, a lot of people do Kegel exercise where you basically just clench like you're trying not to let a fart out or try not to shit yourself. Clench on and then release, clench and release, clench and release. So that's a way to build that muscle. But there's also an internal anal sphincter as well that is made out of circular, smooth muscle that you can't voluntarily control. Okay. The way around these two muscles is, and this is a thing I have on my Instagram. It's called the butt clock. It's an exercise to when you're just about to go for penetration. If you lube up your finger and stick it in about an inch or two, and you press over to say 9 o'clock or 3 o'clock, or say even 12 o'clock or 6 o'clock. I think I just made the sign of the cross. I'm sorry. Right. Different kind of cross, honey.
Yeah.
So if you hold it at that 3 or that 6 or that 9 or that 12 position, that tight, tiny little circle is going to relax and open up to a bigger circle. And you keep going and keep holding that pressure. It keeps expanding and expanding and expanding. I can't tell you how many guys have come to me on my Instagram and said, "Oh my God, you saved my marriage. I'm doing I'm doing the butt clock and my husband loves it. And he's got a big dick and it's hard to take. And now I can do it because you taught me how to relax." So so those muscle fibers need to relax, because if you just jam a dick in there, you're going to tear somebody's asshole, and it is not fun. That's what's called an anal fissure. And it's painful, and it can last for months, and it can require surgery. Never do that to a bottom tops. Please never do that. Don't just jam it in there. Please, 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 please. Lubricate, play with it, stretch it out a little bit, and then go in there. So
listen to them. If they say stop. Like,
yeah,
absolutely.
And I have some tips on bottoming later, especially in that first couple of minutes can be a little bit harrowing. We'll talk about that. So it also depends on what you're trying to put in there and how big it is. Because, small to average, not going to take as much as a big, thick dick.
Sure.
Yeah. And, and they're all beautiful in their own way. But hey, listen, some you need a little bit more relaxation for than others.
Yes. Yes. So the clock thing. So you start at, it doesn't matter which one you start at. Right?
It doesn't matter where you start, as long as you put that pressure over to one side or up or down and just hold it, and keep your fingers straight and firm, and then hold it down against that circle, and you can, and just so that you feel the tension in the circle gently. Now, if the bottom is going not so much pressure, but just gentle pressure up against that circle, it's going to start releasing and allowing bigger things to come in. And when people come in the emergency room with foreign bodies, that's one of the first things we do to help relax them is just to, stretch the anus open, actually while they're knocked out by that point, because it's a big deal to take something out of somebody's butt when it's stuck up there. And that's one of the things I don't think we're talking about today. But if you're going to use a butt toy, make sure it has a wide base. Without a base, without a trace. Butts are hungry. It'll suck whatever you got trying to go up in there, and it'll go right up in there. So you got to make sure you don't lose whatever you put in there if you're playing.
And then it gets stuck, and you got to go to the doctor and tell them.
Or you got to go to the ER during a pandemic with something's caught in your ass and see how you
don't
get
be that guy. Don't take up a bed that could go to a COVID patient because
I know exactly.
Your ass.
Not do that. Yeah. So bottoming. The first keys in bottoming: make sure that your diet is good. Diet is really important. It can reduce the amount of clean out that you might have to do prior to anal sex. Some guys don't even clean out. Mm-hmm. I personally couldn't get away with that because that's just not happening. But especially some younger guys can just be on a good high fiber diet with a fiber supplement of psyllium husks, and it's just they don't need to clean out as much or at all. But I tell people, if you're going to clean out, don't use a harsh chemical. Anything like the stuff that's in the bottles that comes from the pharmacy can irritate your rectum and cause it to be inflamed. And that leads to increased risk for passage of STDs when you have inflammation in your rectum. So I recommend using lukewarm water, not hot because you don't want to burn your ass, and not cold because you don't want the cramp that comes from that. So use lukewarm water, squirt it in, release it, and keep doing that until the water's clear. And that's the running joke in the bottom community. That was me until the water was clear.
Yeah.
So get the water clear. I personally like to have a clean garage before I put a car in there. It feels better as a bottom to have things cleaned out. If somebody sticks their dick in there, you're not feeling things mash around. If there's stuff in there.
Is douching, because I had heard that douching too much is bad for you, that there's glands or there's like a natural lubricant or something on the anal wall that it takes away.
Well, I've been in GI medicine for 20 years. I've never had a case of someone come in who douched too much.
Okay.
Like, he douched too much, Give me 2 tubes of anal lubes, stat. It's theoretical. Obviously, you can do too much of anything. Mm-hmm. I recommend for people to use only as much as they need to clean out. And you have to also be careful about putting too much water in, because the first 8 to 10 inches of the bottom part of your GI tract is the rectum. But then there's this big hairpin turn where the sigmoid or S-shaped part of the colon is. And if you put too much water up in there, it can go over that hairpin turn and kind of get trapped there. And you can be in the middle of having sex and then, water rushes out. So use as much as you need. Just when you think you've got all the water out, get up and shake it around a little bit and sit down again and let it out. Now, if you don't need to clean out, hey, that's awesome. Great. Good for you. But I find that a lot of the gay community cleans out, and everybody, and whatever works for you is fine. And the other thing that I think that we need to make very, 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 very clear: shit happens. That's where shit comes out. So if you stick your dick in somebody's ass and you get a little poop on it, do not embarrass them. Do not shame them. Don't get all grossed out. Just clean it off. If they want to go and clean up a little bit, and keep going, because although it's not always the most pleasant thing, you're sticking your dick in somebody's ass, and that's where poop comes out. So you have to get over the fact that accidents happen. It doesn't make a person a bad person. Yeah. That's like they say, if you play in the coal mine, be prepared to get a little dirty sometimes. But there's ways around that to clean out, and that's not, it's usually successful, but sometimes things happen. Even in the middle, things can happen. But don't get shamed by that. There's no need to be shamed about having an accident during sex, because that's a natural human thing to have happen. So
for people for people who don't clean out, or maybe they are in the heat of a moment and they don't have time to, is there a way, is there a certain feeling that you can kind of know if it's going to be clean or not?
I think people know their own bodies. Like one of my friends is a big sex educator from Showtime, actually, and she says that she knows when there are bullets in her chamber. Yeah, she can just tell.
Yeah.
Yeah. So I like that. You know, if you know your own body, you can probably figure it out, or just know how you're built. You know, some people are like they don't need to clean out because their bodies don't work like that, or they eat such a great diet that they don't have a lot of residue. But the good thing about fiber is it kind of bulks things up and minimizes the residue.
Or sometimes you take a shit and you know, okay, I'm clean now. Like when you take one of those amazing shits and it's like, there's nothing down there. I feel amazing.
Exactly.
Yeah.
And there are other times when you ate Taco Bell and you're like, oh shit, this ain't gonna happen today.
Yep.
That's another thing I wanted to talk about with eating and bottoming. So there is a natural reflex that people have called the gastrocolic reflex. So you wake up in the morning, you go get a cup of coffee. Within 30 minutes, you're on the toilet, taking a shit. There is a natural reflex that happens when people eat or when people drink, where when the stomach is distended and stimulated, it sends a response to a signal to the rectum to empty, to make room for the stuff that's coming in by making the waste exit. Now, some people that only happens in the morning. But some people, every time they eat and sit down, they're up from the table and go into the bathroom within 5 to 30 minutes because they ate and they got stimulated. So there's the running joke, and I think I even made a TikTok about it, how you can tell who the bottom is when you go out on a date and you see two guys at a table. The top is just eating like a pig, and the bottom has like a salad and ice cream,
a piece of lettuce, a walnut.
Yeah, and that's a huge thing. I don't want to make people have like eating disorders over bottoming, because that's not the point. I'm just saying, just plan sex around when you eat.
Yes, yes, and fiber supplements. That's a big one.
Do you
suggest like Metamucil? I know you mentioned something else earlier.
Yeah, so Metamucil is basically psyllium husk is Metamucil. Yeah, and it's the same. There's a popular supplement for gay men that I won't name because I'm not being paid by them.
Not sponsored.
That uses the same kind of technology, and it's really effective.
Okay.
Yeah, but there are different price tags on different things. So
offline, tell me which one that is.
All right, I will. Yeah.
Cool.
I've actually been approached by them to advertise, and I'm a little bit,
Did they lowball you?
Well, no, they haven't. But no numbers yet. Let's just put it that way.
Okay. Fair.
But I'm also somebody of high moral fiber, where I don't want to, like, when psyllium husk is cheap and it does the same thing, I don't want to tell people to spend $50 for something,
Yeah, not selling those bullshit, like there's people that sell like bullshit tea diets is like $60 tea is gonna make you skinny. Like
right, exactly.
Yeah. And one other thing, I mean, and I know this from experience too, but like let's talk about breath work and the importance of that, or how that can help when bottoming, because I know that there's some routines that you can do, or certain breathing exercises that you can do to kind of loosen that up and get it ready.
Right. So exactly. You mentioned with bottoming and relaxation, 95% of sex is in your head. And if you're anxious and have some fear in you, and your body's natural response is to tighten up and clench up.
Yeah.
So just by relaxing and breathing, those things are going to open up. What's something that you've run across that you like to do with your breathing exercises for something like that, or something you've heard?
Yeah, I do. This it's pretty standard too. I can do it when you're not bottoming, but it's a 3-second inhale, slow. You might hold it for a second or two, and then 3-second outhale, and really just try to clear your mind. It's almost just like meditation, even. Like,
I like that.
Literally just trying to get out of your head. And because the first time I'll be honest, I had a great top the first time I bottomed. Like I lied to him and told him it wasn't my first time, but I think he like knew, because it was like, yeah, we were going really slow, but he was just like, he was guiding me through it. He's like, okay, breathe, like do all this stuff. Yeah. And so yeah, that's what I kind of do. I just try to just calm myself. Even if almost like if I was freaking out because I was having anxiety over something, I'd be doing the same exercise. So it's just calming yourself. Yeah.
Right. So we mentioned diet and douching. Lubrication is key. I like silicone lubes, just because they're really super slippery. And if you have any sort of irritation down there, it kind of like forms a nice barrier. And it also doesn't gum up like water-based lube does. Water-based lube is water-based, so your rectum is going to take the water out of that lube after a while, and you're just going to be left with a sticky gunk. Yeah. So I like the silicone lubes. They're a bitch to clean up if you get them spilled on your sheets or if you get them on your body. A little old gay man trick that I have, because I'm an old gay man, is have a little bit of Dawn dishwashing detergent in your shower, or some shampoo for oily hair or body wash for oily hair, and it really cleans up externally very nicely, those silicone type lubes. So number one, good lube. When it comes to lube and sex, remember, if you're using condoms, the only things that are safe for condoms are water-based lubes and silicone-based lubes. If you use coconut oil or if you use petroleum or something like that, it's going to eat right through those condoms. So you cannot use oil-based lubes. Gun oil is not oil, it's silicone. So, when you see that name brand, so that's safe for condoms. But if you use something oil-based, it is not safe for condoms. So keep that in mind. So water, like a lot of people, it's kind of in vogue to use coconut oil. Also not safe for.
Yeah, thanks, Jay Alvarez.
Right, exactly. So the other thing that I really wanted to mention, so we mentioned the relaxation through breath work and through pressure. If you're a new bottom, or if you've ever been hurt before, or if you're tight, you want to start off on top. You control how fast it goes in, how deep it goes in at your pace, so that you don't get ripped or torn or hurt, and you make it a pleasurable experience on your own terms. Because as soon as you get it all in there and you can take some nice deep breaths and relax, you can go to town. You can stay on top and be in control, which is kind of hot. Or you can just let the top take over. But I know in a lot of dom sub kind of things, that's not exactly always desired. But for those first 2 minutes, let the bottom start off on top. Let the bottom get comfortable. Tops, make sure that you get your bottom comfortable and relaxed so that they're ready to go and you don't hurt them.
Yes, and I'll add, don't be afraid to tell them it's your first time.
Yeah, don't be afraid.
Yeah, if they're a good person and they're good, like they're going to walk you through it. They're going to want to help and make sure it's nice for you.
Absolutely. And I mean, what an honor,
right?
for a top to or even a bottom to be the first for someone else. I mean, that's a huge thing in someone's life. So obviously, they're going to make it extra special at that point, in my opinion, if they're a good person.
Yeah.
Some people are just jerks, and you can't get around that. So those are the tips for bottoms: relaxation, lubrication, diet, douching. All those things. Don't douche too much. Like you said, you can do too much of anything, but it's not going to kill you to douche. People get all upset about you're destroying your microbiota or your microbiome with all the flora. And I'm like, dude, the next shit you take is going to replace all those bacteria. So don't even worry about that part. So for tops, we mentioned, you got to go slow. You can't hurt somebody. You can't just jam it in there. Take cues from the bottom, make sure that they're not hurting, make sure that they're having, that you go slow and that they're able to take it all. Make sure that they're enjoying things too. I know there's a tendency for people to just want to jam it in, but that's the way people get hurt.
Right. Communicate it. To be asking, is this okay? Does this feel good? Start with like just the tip, right? Like just barely put it in there, and then
and then a little bit deeper, and then a little bit deeper until you relax and you can take all of it.
Yeah. I had one experience with a top that was just jammed it in there and didn't know what he was doing. Thankfully he had a tiny dick.
Well, I was unfortunately on the receiving end of something much bigger that way, and it made me jump through the roof. I remember being bent over, and it just went wham, and I went like, ah! I jumped off the bed. And so from personal experience, you don't want to do that to somebody. And like I said before, I know guys who've had to have surgery because they got ripped so bad.
Wow.
Yeah. And you don't want to put a bottom out of commission.
Yeah. No. Don't do that. Don't do that. So speaking of bottoms and bottoming, how does one who's new to this or questioning their sexuality, or even a straight person who might be into anal play, how do you know if you like playing with the bottom?
Well, you don't know until you try it, and that's the thing. And one of the things that I think that's really sad for a lot of the hetero community, a lot of guys that are straight or strict tops that don't allow anything in there, the prostate is a couple inches in there. I didn't know what made my eyes roll back into my head until somebody fingered my butt and gave me a blowjob at the same time. Like, seriously, the first boyfriend that did that to me, I thought I was in heaven. I mean, there's no better feeling than that simultaneous, gentle prostate stimulation and getting head at the same time. It's like, whoa. Whoa. So I really feel bad for straight guys that don't get that done, because it's pretty amazing. And trust me, so my first video was Butt Stuff 1 and 2 on TikTok. And I released it and thought, we'll see what happens. The first response was some woman's daughter who said, "Oh my God, how could you have this on TikTok?" And basically threatened me. And I said, okay, either I can take the video down or I can block her. I just blocked her. And then I woke up the next morning, I had 50,000 new followers and the videos had 1.4 million views. And I thought, oh, good. All the gay boys are following me. It was over half women.
Wow.
And straight women and straight guys and gay guys too.
Sure.
But yeah, people want to know how to do this because nobody talks about it.
Right. I mean, I could imagine adding butt play to cis-het couples relationships could, oh my God, I'm sure they're missing out on so much.
Yeah, but yeah. So one of the things I really want to get across today in some of my final words is that butt stuff doesn't have a gender. It doesn't have an orientation. It doesn't define your masculinity or your femininity. Everybody's got a butt. Everybody's got all those, well, most people. There's some people who have had surgery, but everybody's got it, and everybody's got all those nerve fibers. Why not take advantage of all the amazing pleasurable sensations that are down there instead of ignoring that part of your body just because of religion or shit phobia or not being masculine because you feel like you're not masculine because of it.
Or thinking it's gay.
Yeah, or it makes you gay. It's not gay. Gay doesn't mean have anything to do with having things in your butt.
No.
Gay is who you love, or you're attracted to.
It's like going to like a 5-course restaurant, getting like the whole deal, but skipping dessert because
I know exactly, right?
Chocolate cake with strawberry, that's gay. Fuck that. Like,
exactly, totally.
You're missing the best part.
Yeah, exactly, totally. So that's really an important thing that I think that a lot of people are missing. And even women, they don't have a prostate, but some women can orgasm from receptive anal. The urethral sponge in that frontal area of where the bladder is kind of, you can indirectly stimulate it through the penetration. So a lot of women really find that exciting as well and pleasurable.
Sure. Mm-hmm. And I think, that kind of leads to my next point is what should a good bottoming experience feel like, if you could describe it in words, and also on the flip side, a bad experience, so that people know what they're having. Because I feel like some people, especially if they get embarrassed or they don't, like, they're unsure. They're like, is this how it's supposed to be done? Like, it kind of feels good. Like they don't know what to think of it.
Yeah, and I'll get some input from you on that too. What you
think?
I think that a good experience, obviously, you're gonna feel great. It's gonna turn you on. It's gonna make you want to come, or it's gonna make you come. That's a good experience. One where you're holding on for dear life. You're not enjoying it. You don't want to be there anymore. It's painful. That's a bad experience. So you need to, if things are going wrong, you need to change something, change the position. All of our curves are differently. Some guys' penis curves up, some it goes, up, down, left, sideways, whatever. So and some people's rectums are also angled a little bit differently. So if one position if you have one bad experience because of the way that somebody's built and positioning, don't throw away the baby with the bathwater. Make sure that you at least try to change it up a little bit or try it again sometime. One bad time doesn't mean it's something you should never do again. Like I talked to some guys and guys are like, oh, I tried anal sex once and it wasn't for me. Well, maybe you didn't clean out right. Maybe you didn't lubricate enough. Maybe you didn't stretch enough. Maybe you didn't try the right position. Mm-hmm. So it's one of those things where just because it's bad one time doesn't mean it's going to be bad all the time. And trust me, we've all had a bad one.
Yeah. Yes, we have. So I guess, yeah, and then I'll tell my tidbit and share with my experience. So I think that like in terms of a good bottoming experience, it should, as you said, it should feel good. It shouldn't feel any painful. It might feel like you obviously feel like there's something there, but it should feel almost smooth, like it's not, it's smooth, it's painless, but you're feeling good.
Yeah.
And a bad one is there's pain. There's always or it feels like there's resistance. Sometimes it's not too painful, but it's like every time it's like going in or whatever, it's almost it doesn't want to. Like it's not accepting it, it's rejecting it.
Or he's hitting a wall. Yeah.
Oh, okay. That's
Yeah. So that's where the position changes need to happen because, like I said, the curves are different, and there's kind of a curve up sometimes, and if you have a curve down and you go in, you're just going to keep banging up against that wall, and you're not going to get anywhere. So so exactly, you're right. It shouldn't. If you're not having fun and it doesn't feel good, then change something.
Yeah. I don't know how I would describe the pain that I felt is like a sharp pain. I'm not sure if that's normal or that's how most people feel, but it's like a sharp, pinching pain. But
sure, everybody has different sensations on what they negatively experience. Yeah.
Well, Dr. Carlton, I think that we've had a great conversation so far. I think we've had a very productive conversation. And learned a lot. I mean, hell, even I learned a lot as we just talked about. I'm going to go see my doctor now.
Well, I think it's important for people to be able to ask questions and not feel ashamed and not feel stupid. People always ask me questions on Instagram. They're like, hey, do you mind if I ask you this? And I'm like, dude, that's why I'm here. Right. Ask away. I mean, I might not have the right answer for you or the answer that you want to hear, but I'll give you my opinion on what's happening. And it's been anything from, STI questions to some really serious stuff. Like I'm in Saudi Arabia where it's illegal to be gay and I could be executed if I'm found out, and there's something on my butt and I had unprotected anal sex last week. And I'm afraid that if I go to the doctor, they're going to know that I had anal sex and they're going to execute me. And I'm like, oh my God, there are multiple countries in this world that have that kind of penalty for people who are gay. And so like I'll say, well, send me a picture of it, a vanishing mode on Instagram, just so that I can see what you're talking about. So if I can, because that's about all I can do is just try to reassure you. And I'm like, oh, no, that's just a hemorrhoid. Don't worry, you're fine. And just to be able to give that sense of relief about whether someone's going to die or not because of an execution because they have anal sex. I never thought I'd be doing that on TikTok. Like this is not what I came here for, but I sure am glad I'm here because it's making a huge impact on a lot of people's lives.
Yeah, absolutely. It's amazing what you're doing. And I mean, it's even more beautiful where you were coming from in the beginning, seeing your community being affected by AIDS and being discriminated against by doctors yourself. And then to now having people in Saudi Arabia reach out to you and seek you for help. It's got to be a wonderful feeling. So
it's
congrats on that.
Thanks. Yeah, it's crazy.
Well, do you have any just closing advice for the LGBT community or just people in general, listeners of this podcast?
I think the number one thing that we should all know is that we shouldn't let sex shame us. There should be no shame associated with sex. Sex is a normal human desire and need. And and you can have sex once a day or once a month or once a year or 5 times a day. It doesn't make you a bad person, the way you have sex or who you have sex with. So don't let sex shame you. It's, I also want to make sure that people are able to be open and honest with their doctor. Make sure you check out that glma.org website. So you can find someone you're comfortable with. Like I said, they don't have to be gay. They can be straight, but somebody who's going to support you and who knows what they're doing. Love the skin you're in. As a gay man who grew up with perfect, especially, you see all these advertisements for clothes or for vacations, and everybody has 6-pack abs and has a perfect body and perfect skin. Love the skin you're in. You don't drive yourself into an eating disorder. I talk about in one of my recent TikToks about body dysmorphia. There was a point in my life where I thought I was fat, like I was disgusting, and I was 6'3", 165 pounds. And I had a cancer doctor in the hospital come up to me and say, "Are you okay?"
Oh, wow.
And that kind of made me realize, okay, I need to get a grip here. Here I am talking to a 300-pound coworker who's offering me cake. And I'm like, oh, no, I don't want, that's going to make me fat. And you know how ridiculous that sounds.
Sure. Was that perpetuated, you think, by the gay community at all, in the body standards that we have in our culture?
Definitely. Because you feel that desire, like you're not going to be sexually attractive if you're not perfect. And what's sad is a lot of the people that you see on Instagram who look beautiful and perfect by those standards have the lowest self-esteem because they think there's some sort of flaw that they have that everybody's noticing, which is not there's nothing wrong with being physically fit and healthy and happy, and that's great. If you have 6-pack abs, good on you. I'm not slamming that. I'm just saying that you shouldn't let it get to you psychologically to where you feel like you're less than somebody else because you don't have a perfect body or perfect skin. Remember also that I talked to you earlier about being inclusive. You equals you. Undetectable is untransmittable when it comes to HIV. Treat people who are HIV positive with dignity and respect. They deserve it. There are brothers and sisters. Protect yourself with PrEP and protect yourself with vaccines. So if you're sexually active and you are a good candidate for PrEP, absolutely talk to your doctor about getting on PrEP. Get your HPV vaccine if you're young and you haven't had it. Get your hepatitis A and B. Most people have had that. That's kind of part of the routine. Get checked with your doctor if you're sexually active for STIs. Wherever you put it, it needs to get checked. So
that's the one I remember.
Get your throat swabbed. If it goes in your butt, get your butt swabbed. Do your pee test. Do your blood test. That's the Cadillac of testing right there when you get those things checked. And basically just kind of to shout out my social media. So
for it.
I'm at Dr. Carlton, DoctorCarlton, Dr. Carlton, all one word, on TikTok and on Instagram. TikTok is about 163,000 followers right now, and it keeps to be growing every day. And that's kind of a mix of comedy and butt stuff and GI health and just being stupid, like everybody on TikTok.
That's right.
And then my Instagram is starting to really build too. I have about 6,500 followers on Instagram. One of the funny things about Instagram to me, which is the same name, by the way, is that I can put a video that I put on TikTok with 163,000 followers and put it on Reels and get 10 times more views on Reels than I do on Instagram and then on TikTok.
Yeah, so it's so bizarre. Strange, isn't it? I had a video specifically that it got like 5,000 on TikTok, and my TikTok account is way bigger than my Instagram account. And this was back in August when Reels first launched, and I put it on my Instagram, and it got, I think it got 1 million views on
Yeah,
Reels on Instagram.
That's amazing.
And like 5,000 on TikTok, where I have an audience of 3. What?
Yeah, exactly. So I'm less so, but I'm present on Twitter at Dr. Carlton _ between the doctor and the Carlton. So Dr. _ Carlton. And then I have a website that's being built right now. It's drcarlton.net. And that's where we're going to put a lot of the podcast appearances together. We're going to put some YouTube stuff up there that's going to start as well. And then just try. My goal is to try to be the gay Dr. Ruth.
Yes.
we need that in our community. We don't have that sort of visibility in the sex community right now. So that's me, and I'm available for your questions. If you have questions, if you have concerns, Instagram's probably the best way to reach me with those, because there's just so many people on TikTok. But you can send a message on TikTok too, and I'll do my best to get back to you with a response. Sweet.
Yes. And once the gays and the barbs take over, you'll be in Dr. Fauci's position in the White House.
Right. Yeah. Although there's probably some photos from some Atlantis cruises that will deem me not.
Hey, we'll be in a time when everyone's gonna have their racy or naughty photos.
Hey, listen, if the last guy can be president, anybody can be president.
That's right. That's right.
Awesome.
Well, thank you so much, Dr. Carlton, for joining me today. I had so much fun. I love what you're doing. I'm glad you're doing it. I'm glad you're here.
Thanks so much, Ryan. And I love what you're doing. And I think it's just amazing how, the things that your organization does and your podcast does. And we need you a lot. So thank you for what you do.
Thank you. Well, we need each other. So keep it up. And thank you to all the people listening. I hope you all have a beautiful evening.
Bye, everybody.
Bye.